My name is Jason Lee. I'm the CEO of Focus Hope, and we're happy to have you here today. On behalf of the Board of Directors, our staff, our partners, and the community that we serve, I bring you welcome. Focus Hope's mission is to use intelligent and practical action to overcome racism, poverty, and injustice, and to bring the metropolitan community together so that all people are living in freedom, harmony, and trust and affection. That is exactly what we are doing here today. Applying intelligent and practical action in the way of creating jobs for the Detroit community. First of all, I want to thank Mayor Duggan and your leadership team for having this announcement here at Focus Hope at our university partner, Oakland University, at our facility. We're extremely excited. With me today are obviously the mayor of Detroit, William Lassiter, he's the CEO of Henry Ford Hospital Health System. Gene Meyer, CEO of St. John Providence. Dr. Tony Tedeschi, thank you. Tedeschi, CEO of the Detroit Medical Center. Gary Moore is the Assistant Dean of Oakland University School of Nursing. Teresa Rogers is the Executive Director of Oakland University School of Nursing, Continuing Education. And Nicole Sherrod-Freeman, President and CEO of Detroit Employment Solutions Corps. Focus Hope and this community are alive and well. With the renewed focus on food, careers, and community, we're really creating a difference in the lives of the people that we service daily. Through our career programs, we are helping the most vulnerable and disenfranchised members of the Detroit community overcome barriers and establishing promising careers that lead to a better life. With your help, we will prevail with the fight to overcome racism, poverty, and injustice, and make Detroit a better place. So without any further ado, the Mayor of Detroit.
All right. Thank you, Jason. This is a major step forward in the city of Detroit's efforts to train Detroiters with the skills for those jobs that are actually being filled. This is a new direction, and when we started the Detroit at Work brand, we said we are only going to train for jobs that people are hiring for today. I don't want those who go through the effort, work hard, to have the broken hopes of the job not being there. And so one of the initiatives that Jeff Giordano and our team did was to sit down with Gene Meyer from St. John's and Wright Lassiter from Henry Ford and Tony Tedeschi from DMC and said, what jobs are you having trouble filling today? And they said, right now we have patient care jobs, sitters who can watch a troubled patient, patient care associates who might be called nurse assistants by some folks. We are having trouble filling those jobs today. We said, all right, if we put together a training program, how many people would you hire over the next 12 months? And these three institutions, our largest healthcare employer, said, we'll hire 240 people in the next year. And so we put together this partnership with Oakland University, who partners with Focus Hope, DESC, and a number of others. But in this great training center, we're going to provide the kind of training that you need to deliver health care today. And so for our residents who are out there thinking, I've got something inside me that says I can be good with people. And I won't tell you these patient care jobs are easy. They're not. You need to have something inside you that says, I'm good with people, I want to be helpful, I've got love in my heart, and I'm willing to work hard. There's a real career here that can start as a sitter, can move to a patient care associate. Ultimately, you're going to hear from an individual who's gone on to be an RN, and I don't have any doubt at some point she's going to be running a hospital. By the time you listen to Angela talk, you'll be convinced as well. But these are ladders to really good careers. So you can go to the Detroit at Work website. You can register for this program, get enrolled, and know that if you successfully complete it, there's a job here. This is the way government should be partnering with our major employers. And I just am so grateful to St. John's, Henry Ford, and DMC for making the commitment to say, if you'll train them, we'll hire Detroiters first. So thank you to all three of you, and I'm really glad to be here today.
And I think we'll have ladies first. We'll have Gene Meyer, CEO of St. John's Providence, give some remarks.
Yes, good afternoon. It is great to be standing here in front of you with my healthcare colleagues from DMC and Henry Ford. And it's great to be a part of another creative strategic plan from the mayor on how we could better improve the lives of Detroit and its citizens. Under the leadership of Senator Providence, of Henry Ford and DMC, we came together to decide how can we collaboratively work together to meet our needs as a healthcare system as well as the needs of Detroiters. And so we committed to 240 training of Detroit residents to become both patient sitters, observers, and patient care techs. It's always a need in our healthcare system. So as the mayor said, we are telling people they will have a job. So it's thrilling for me to see the whole continuum of having a wonderful idea and vision to being able to have a strategy to now being able to implement it. So it's been a wonderful collaborative for all of us. Thank you.
Our next speaker will be Mr. Wright Lassiter, CEO of Henry Ford Health Systems.
Good afternoon, everyone. First, Mayor Duggan, thank you for your leadership and for your vision to create a better city for our residents. Jason, thank you for hosting us, and to my colleagues, it's great to be in partnership. This afternoon is about the C word. It's about collaboration. It's also about courage, the courage that our mayor has shown to push things forward. And so the collaboration that you're hearing about is something that Henry Ford Health System is excited to be a part of. We employ about 28,000 people. Many of our employees are residents of the city of Detroit. But we clearly know that there are many Detroiters who have obstacles and barriers to employment. And we also know that we have the problem of, at times, not having enough people in the pipeline to fill the roles that the mayor and Gene have talked about. So we're very excited to do something together. I think, as we all know, together always gets things done better than alone. And so this is an afternoon to say thank you to our colleagues for committing to hiring. And we are excited. I have some of our folks in the audience who are part of our hiring process, and they're excited to see the folks get through this program so that we can hire them in Henry Ford Health System. And as the mayor indicated, we have a very special young woman who will be talking a little bit later, who has gone through the path of training in high school, to coming into the healthcare field at an entry-level role, now serving as a nurse. And Mayor, I would agree with you that she likely will be running a hospital someday, a Henry Ford hospital, but a hospital someday. And so we look forward to hearing from Angela a bit later. So thank you all for joining us this afternoon.
And from DMC, we'd have Dr. Tony Tedeschi.
Thank you. Well, good afternoon, everyone. It's certainly a pleasure to be here. Every day I'm surrounded by a great many individuals who are shining examples of the talent to be found within this great city. Today's hospital industry is ever evolving, but one thing remains constant, and that's our need and the demand to focus on outstanding patient care. At the DMC, we're happy to play a role in getting Detroiters back to work, while at the same time building a pipeline to fill these much-needed entry-level jobs. I join our colleagues today and partners in celebrating the fact that after much hard work, our teams have developed a plan that we are certain will sustain training our quality individuals to work in our hospitals. Mr. Mayor, thank you for this wonderful opportunity. Let me also thank my colleagues and the many individuals who put time and effort into making this happen. Appreciate you all.
The space that you're in, for those who may be watching this on TV, looks like a hospital, but this is actually part of the Focus Hope campus on the corner of Linwood and Oakman. This is our home for our program here at Oakland University, and at this time I would like to have Gary Moore, Assistant Dean of Oakland University School of Nursing, and Teresa Rogers, Director of the Oakland University School of Nursing Community Extension Program, to come.
Thanks for everybody that's here this afternoon, and we're pleased to partner with the mayor and the workforce development team to provide training for this new healthcare initiative. Like our partners here today, Oakland University believes that education is for everyone who wants it, and we are proud and excited to be part of this venture. Participating in collaborative efforts such as this one will help educate more hardworking people who want to earn a living, work in a rewarding field with opportunities to continue on a career path with educational mobility, which you'll hear about in a couple of minutes. In addition to preparing skilled healthcare professionals, the initiative will also help provide a much-needed workforce for our healthcare partners, improve the health of Detroit residents, and expand the culture of learning and achievement within the community. The growing healthcare industry has felt the challenge of finding enough qualified and skilled allied health professionals in recent years. It is our hope that to provide a more stable workforce for our healthcare partners with this collaborative project. Our communities come alive and thrive when we work together for a worthwhile cause. And we're thrilled to be joining the collaboration of industry leaders, the Detroit Medical Center, Henry Ford, St. John Providence, the City of Detroit, Focus Hope, and Detroit at Work, increasing with the expectation of better handling the increasing demands of healthcare for healthcare professionals. We genuinely appreciate your support and all that you do each day to encourage and celebrate the nursing profession. I'd like to thank the administrative team, faculty, and staff on campus here at Focus Hope for their ongoing commitment to achieving excellence for our students. And with that, I'd like to welcome to the podium the woman responsible for pulling together the staff, instructors, and ensuring that the facility and procedures are running seamlessly. Executive Director of Oakland University School of Nursing Continuing Education at Focus Hope, Teresa Rajas.
Good morning, Mayor Duggan. It's so exciting to be here today. We get past Gary's remarks. First and foremost, I'd like to thank our Assistant Dean, Dean Gary Moore, for all of his support. Jason Lee and all of the staff here at Focus Hope, we couldn't have a better family to work with. We thank Detroit Employment Solutions and the Workforce Development Team for this great partnership. The Oakland University School of Nursing continuing education programs at Focus Hope have tremendous potential to make a lasting impact on the health of the community that we serve. Through the blending of classroom and clinical education provided by Oakland University and the exceptional academic remediation programs developed by Focus Hope, these certificate programs will greatly enhance the lives of our students as they become healthcare providers. We cannot wait to begin the education of 120 future patient sitters, constant observers, and 120 future patient care associates next month. This type of training program is ideal for those who want to explore their career potential here at Oakland University. Our students will be able to expand on their strengths and find rewarding jobs with amazing healthcare systems like DMC, Henry Ford, and St. John Providence. This is where they will be conducting all of their clinicals. Our goal is, and has always been, for our students to graduate with the best clinical skills, best team training opportunities, and best preparation to meet the challenges and demands of today's nursing profession. We have remarkable bachelor's and master's prepared instructors. Some of them are here today, and they are ready and eager to educate our students. Having highly educated instructors who understand how to teach in a classroom environment, but can also share their experiences from the bedside, will ensure that our students leave these certificate programs prepared for whatever might encounter on the job. So many of our instructors work at the Big Three, and we're really proud of that. Beginning any education program can be both exciting and intimidating, and even overwhelming for some of our students. OU staff and instructors, along with the trainers from Focus Hope, will be there for them each and every day for each step of the way. Our students are the reason we are here, and I feel that they can tell us better than I can how our work is changing lives. Later, you will hear from some of our students whose lives have been impacted, which will remind you and us of why we do what we do each and every day. This is a special moment for us to recognize and appreciate all of the critical elements necessary for success, from academic preparation to clinical placement setup, to remedial assistance, to financial guidance, to professional readiness, coaching, to on-site child care services here at Focus Hope, to access to public transportation and on-site social services. All of these elements are important cogs in the educational wheel. We look forward to making a meaningful impact here at Focus Hope on this community. And we hope to improve the quality of life for the residents that we serve. We look forward to improving access to educational opportunities and providing career training that will transform our graduates. So once again, on behalf of the staff that's here, all of the Oakland University and Focus Hope team, we thank you. We thank the hospitals, and most importantly, we thank our students for making Oakland University their choice for training. Thank you again.
Put this down there. All right, so probably the most important person in the room right now is actually a student or a person who's participated in one of these programs. Not discounting you at all, Ms. Mayor. But at this point, I want to bring to the to the podium, Miss Angela Floyd. Angela is currently employed at Henry Ford Health System, and will tell a little bit about her story and her journey in education.
Thank you. As a proud Detroit native and a proud product of Detroit Public Schools, I'm absolutely honored to be here speaking with you guys regarding this program. I started working for Henry Ford when I was 19 years old as a patient care technician, and with their amazing support, went on to receive a bachelor's degree from Davenport University in 2014, and their continued support has gotten me here where I'm working toward a master's degree at Michigan State University. Thank you. Being a patient care technician gave me indescribable healthcare experience, and I've maintained and developed so many lifelong relationships with mentors who to this day continue to influence my career. I think that this program that they're offering here is an amazing initiative for all of the Detroit residents who have even a remote interest in healthcare. It's kind of a way to get your foot in the door and really get the training that you need and the experience, because it's always the experience that's going to get you involved and really make you want to help people. I applaud all of these amazing people behind me who have put this together and supported this program. I wish there was something like this 8 years ago when I started. It would have been amazing to have those opportunities, and I look forward to seeing where this program is going to go.
All right. At this time, we will take questions from the audience. Yes, ma'am.
How are you training people on this program?
Talk about.
How are you doing training?
How we're going to training? What we're going to do is...
You got to come to the mic.
Oh, okay. Thank you for that question. The question was, how are we training people in this program? So the individuals that will be training, they will come to Focus Hope first and get any wraparound services that they may need. So we'll be looking at transportation services, child care services, any social services that they may require. And once they go through the Focus Hope sessions, the wraparound services, then they'll come to Focus Hope here at Oakland University for the training, for the patient care sitter program, as well as the patient care associate program. So our part of the training is 2 weeks for the patient sitter program, and then 6 weeks for our patient care associate program. So we're just really pleased to have people come out and be involved in this training, the initial training, and hopefully, as Angela said, you can see them progress through the career ladder and become RNs as well as get their masters and PhDs in nursing. So we're really happy to be a part of this with Detroit.
Yeah, can you go a little bit more in depth about what a patient sitter and a patient care associate is?
Somebody want to describe the jobs?
Sure. As the mayor said, the patient sitter is someone who really stays with a patient who's troubled. They could be at high risk for falls, they could be suicidal, they could be homicidal, they could be confused. And so someone needs to sit to make sure that this patient is safe. And the training will allow them to do that, as well as things to look for in a patient that could be troubled or confused, to make sure we keep them safe.
Yes, next question, anybody? Yes, ma'am? I believe the annual number is 240.
And how often does training is there like a new cohort, or how does it work?
I believe the, go ahead.
How many in each cohort?
It's going to be about 24 people in each cohort, and as soon as we get the first 24, whether it be the patient sitter or the patient care associate, we'll begin the training. So we'll continue on as the workforce team identifies these students. We're going to be ready to take them on and get them through training as quickly as possible.
Any other questions? Yes.
Prerequisites for the training program.
Prereqs?
You might want to just stay right there.
Yeah, really. Well, I, before she answers that, I think that the first part is understanding where to start the journey. And Detroit at Work is the location where people can get information pertaining to the prerequisites and the requirements for the program, as well as timing and scheduling. This information, there's also a phone number, 313-962-WORK, which is 313-962-9675, and the information will be posted there.
Okay, so what's the question was, high school degree? Go ahead.
Yeah, we do want the trainees to have their high school diploma or GED would be great. And then we also do criminal background checks and drug screens. So those are the major things that we will be checking for these potential students. Thank you.
I'd only add one thing to these jobs is high school degree and passing the drug test is important, but you want people who love people. I mean, that's who should be applying for these jobs, because it's a very intense, human interactive job. So you got a high school degree and love of people in your heart, go to DetroitAtWork.com and sign up, because we're going to hire 240 people in the next year, and we'd love to have you. Anything else? All right. Thank you all very much for being here. All right.